We target women in our ads, in our commercials. You've got to look a certain way. You've got to be a certain way. You've got to, fit this idealistic mold. And we do the same in recovery as well. Oh my gosh, you should be so far forward. You're 6 weeks postnatal, or oh, it was only just a first degree tear. Like we try and minimize it and judge, which we have to take our own egos and our own selves out of that while we're treating people with scars. There's lots of research to say about scars and the emotional context of them, but also you can't know how somebody feels about their scar. It might be a tiny scar that has a huge impact on them. Thank you so much. It's such an honor to speak to you.
Same. I'm fascinated by your work.
It's crazy because I never intended, Rebecca, it to be like this. I don't think in my wildest dreams I ever thought it would be like this. All I've ever wanted to do is to make a difference in women's lives, and that's always been the fundamental basis of why I've been a physio for the last 25 years. But everything else is just a wild ride. It is. Why the teaching, being international, the clinic, got 11 staff, all the different services we provide, the scar education. It's wild.
I mean, it really is. If you think about it, like in terms of your business, it is hyper focused on scar care.
Yes.
Is it right?
Yeah.
What made you go that route? What led you to saying, this is a need I want to put my attention and my resources to fulfill?
Yeah, that is a great question. So I left the NHS after 17 years as the clinical lead for physio. And during that time, I'll be ashamed to admit, Rebecca, that, I spent 7 years working in palliative care, and lots of people had scars, and we're not really trained. Like, it's not on the curriculum, it's not on the syllabus to treat scars or, just give any advice. You go, well, yeah, you've got a scar. Like, gosh, you've had major surgery. And the more I work, especially with women, and then have my own children, and I had multiple surgeries in a very short space of time, pre, during, post-natal. And I realized, I was like, hang on a moment. The way we treat women, being on the receiving end, and scarring, I think we think scars are like these dormant things in our body, and we go, they tell a story and they're, part of us. Yeah, but they're actually alive. They actually constantly can, not in all cases, but can impact how we move, feel, what we wear, intimacy, how our body feels inside. And then, of course, grow, stick, adhere, tether, pull on internal structures. They're not just something that is on the surface of the skin. So, of course, I set up some outpatient groups, some clinics in the NHS looking at scars. They were super successful because we couldn't carry it on. There's no money or funding. So I was like, right, so in 2019, I'm going to set up on my own. And not a single person said, go do it. No one said, my gosh, scars. Ooh, women's health. Why would you want to leave a glittering career, being at the top of your game, to go and set up a private practice that nobody's heard of, Hannah? It will never work. And of course, I always like a challenge, and I like to prove people wrong. So it's worked really well.
That's phenomenal. One of the questions that I'm getting, and I was looking through images that you sent me, things about the course that you'll be teaching for Johns Hopkins, which is huge. I want to hear about that, the webinar where I want, this to be broadcast to as many people as possible. I want them to understand your work. And one of the questions I think came up for me as I was looking through your beautiful website. I can only imagine how probably beautiful your clinic is just from what's coming off of the page, really. But the question that came up for me is, I wonder how early does Hannah's team treat someone after surgery or injuries or wherever these scars are coming from. What's your philosophy on early recovery?
Well, I think it actually starts before you go in. So we do lots of prehab. We talk to people online worldwide that know they're going in for surgeries, and we talk about the surgery, what to expect. I mean, this could be anything from C-section, hysterectomy, oncology, hip replacement, and we talk about it. So all those fears, who's going to be in the theatre? What's a theatre going to look like a surgical operating room, not a, yes. I know we call those different things, yes, not a drama. Just to clarify that, I've been, yes, caught out, yes, saying that already. And we go through everything. What you can do, your breath work, your pelvic floor. What is the pelvic floor? How do you contract? How do you relax it? Different things like what tearing is and what we mean by that in the pelvic floor, and how that can affect you, how it might make you feel, what you can do, lubricants, massage, dilators, and we go through everything. So I believe actually early prehab intervention is critical. Empower women to make good choices, but to be educated about what they're going in for, not to scare them. Education is king. And then in answer to your question, because we've given step-by-step instructions, what to do in week 1, what to do in week 2, we normally bring them into clinic at around 5 to 6 weeks. So the scar is normally fully healed over. Research has shown that risk of infection is really dropped off. You're a little bit more feeling more like yourself at that point. The anesthetic's worn off. Those kinds of pain is a bit more manageable. So we normally get them in around 5 to 6 weeks after surgery. Oncology sometimes can be slightly different in terms of like radiation and chemo, things like that. And we always consult the surgeon and the breast care nurse if applicable to do so. But yes, and then we start treating, but also educating again. This is what you can do at home. This is what will really help. This is, what you can do for yourselves. Don't buy those really expensive X, Y, Z. You can do this yourself. You don't need that. And give people the confidence to understand their own scars.
Are you referring to like laser therapy or just different that people are using? Okay.
Yes, we have, and I'm sure you have it in the US as well. We target women in our ads, in our commercials. You've got to look a certain way. You've got to be a certain way. You've got to, fit this idealistic mold. And we do the same in recovery as well. Oh my gosh, you should be so far forward. You're 6 weeks postnatal, or oh, it was only just a first degree tear. Like we try and minimize it and judge, which we have to take our own egos and our own selves out of that while we're treating people with scars. There's lots of research to say about scars and the emotional context of them, but also you can't know how somebody feels about their scar. It might be a tiny scar that has a huge impact on them. So yes, I've completely forgot your question as well, Rebecca. I just got on my soapbox then, and that's it about buying things. Yes, that was it. That was it. Sorry, we'll be here all night. Like you don't have anything else to do you, Rebecca? So that's great. Yeah, great. I'll carry on. We target women, and I really hate it. You will notice my online shop that we have is like the end of my website. You have to trawl the whole website to find it. We do very little marketing across our social media about buying things like products, because I want people to come to us and know they're getting the best treatment, but also if we recommend a product, it genuinely will help you, not just all these beauty things that you get on the shelves that cost a fortune and have very little research behind them when it comes to scarring.
Tell me a little bit about now work with spreading this education internationally, because you went from starting a clinic that very little support was given to you in 2019, right before the pandemic, of all things to do. And now you've expanded to where you're teaching this philosophy nationwide or internationally. Really, you're coming to the U.S. in 2027. And what I found fascinating is just how much I resonated really with something that you just said. But just looking across your website and looking at your materials, and I said, people are given virtually no education prehab before their surgery, and so to hear that you give this week by week, step by step guidance, then following up 5 to 6 weeks later makes perfect sense, right? Because that person is now well informed on things that they can do, positions, maybe duration of time to avoid. I treated a physician just recently who could barely get off the floor with her baby at 9 weeks post C-section. This is a physician after cesarean delivery, first time cesarean delivery. And come to find out, she was nursing really in the same position with her foot on the table and her baby supported. And she was bottle feeding and just wondering why that side of her C-section incision was so painful to where she could barely get off of the floor. And it just dawned on me. I'm seeing her 9 weeks post-op. That's not ideal in our world where early recovery is really communicated a lot with our surgeons. But then also with just the duration of her position, I said, this woman was given nothing. She's a physician, yes, but she still was given nothing by way of step-by-step, ways to recover. And so once we address that and positioning, she just bounced back beautifully, but it's just the weight and the worry is something wrong and just the uncertainty around such a major surgery. I just find everything wanting really in women's health. There's just no cap to the good that we can do. So thank you so much for your work. But I really want to bring this full circle and understand what led you to now educating, so many of our healthcare providers about what you do and what they can do.
Yeah. During my time in the NHS, so I did a leadership and a teaching qualification that lasted, it was two years, to really understand how to deliver information and the importance of delivering information. And interestingly enough, I did that in 2016. Yeah, 17, 18, 19. Yeah, 2016. So I'd been through lots of my career, bearing in mind I started in 2002. So lots of my career, in leadership roles, in progressing through the ranks and doing that, and not having that qualification. And I always wanted to empower others to be the best they can. I do not mind about competition. I'm hungry to see women especially do well and be empowered in places of leadership and authority. I feel our country at the moment would serve very well having a female prime minister and having somebody in the health and maternity services who was a female as well. It's not happening like that. They're both males again. And so I'm really keen to see that happen. And so I did this leadership and teaching course. It was fantastic, did super well. And of course, taught my staff and did in-services and training. But I really wanted more. And when I left the NHS to set up my business, I always knew that teaching my techniques, experience, but what the research says was vital in order to be delivering the best education. So I obviously went on lots of courses myself. I traveled back to the States. I worked on cadavers for a week looking at scarring. I've worked on cadavers in the UK because we have a huge facility in Keele University. Worked with the best people to really understand and learn scarring on a real deep level, anatomy, physiology, and the research. And the more I learn in clinical practice, because I'm still clinical now, I don't want to give that up. So I'm still clinical every week. I want to share that with clinicians to empower them so that we all work better for women's health, that everyone succeeds when we work better together. Always collaboration over competition. And I think in business, especially in private practice, I feel sometimes women get a bit threatened by other women when they're doing really well. I just don't see that. I think if we work well together, everyone benefits. So I wanted to take my teaching qualification and use it for good. I wanted to empower women in business, especially. So as part of my courses, we talk about scars, we talk about clinical work, we talk about outcome measures, we talk about documentation, research, full assessments, breath work, pelvic floor, scarring, posture, movement, strength, all over. Well, it's a 3-day online platform, 2 days in person. So it's 5 days in total. And we cover everything and then look at the evidence, look at the research to empower clinicians to do the best job. And we also talk about business, how to survive, feast or famine. You know, you own your own business. Some days it's great, isn't it? Some days you think, I don't know how I'm going to cope with this. And we talk about that as well, because in the UK, scarring seems to still be like the best kept secret. We're talking about it more, we're promoting it more, we're doing so much. But I cannot tell you, Rebecca, the amount of clients that sit in front of me on a weekly basis that go, well, I didn't know you existed. Oh, I'd never even heard of scar therapy. No one's ever told me about scar. I've had this scar for 6 months. It's caused me so many problems. And it's such a simple thing that could be done before they go into surgery to talk about it, or straight after. And yet we still don't really in the NHS. So that's a long-winded answer to a very short question, Rebecca. Sorry.
No, I think I'm getting the breadth of what you do in the business aspect. I think that is probably missing in just a lot of education, is really how do you apply this, and not just business. What is business? Business are leads,
Yeah.
right? And so if you can't get buy-in from physicians to send these people early, I mean, that's a business conversation as well. How are we communicating the value to the surgeon, you know? And so the fact that you cover the business aspect of treating this population, I think, is fantastic. In the US, we have these stretch clinics that are nothing to do with, you know, physical physiotherapy, nothing like rehab, just, you know, like maybe they have a certification in-house. I have no idea really what the training is, but people go in just to be stretched, have their muscles stretched. And I would really, it makes me think now, what a sub-market of people who have been just suffering from, you know, surgical scars that just were not addressed, or just the healing times that were, you know, not adequately addressed, are probably also circulating even those markets. So I guess my final few questions are, does your training reach out or even connect with massage therapists or personal trainers, or just anyone in the health and wellness and fitness space who want to learn more about this?
Yeah, absolutely. So we're very clear on our criteria. I'm a women's health physio. My SCAR tutors are women's health physios. So we teach from a physiotherapy point of view. However, level 3 massage therapists and above in the UK, midwives, GPs, chiropractors, osteopaths, occupational therapists, they're all entitled to join and learn. And I feel, I mean, we teach a lot of midwives, because obviously they're the first people in, and they get no education in scarring at all, which just blows my mind. So we teach them. But yeah, absolutely. Massage therapists, as long as, so for insurance to do our courses, you would need some kind of massage-based qualification plus insurance to massage a scar. So we're quite clear on that when we are teaching people, because of course we've got the pre-learning online platform. You come with some knowledge already before you attend the face-to-face courses, which is really helpful. And of course you're all supervised, and we treat real scars together. And I use diagnostic ultrasound to look under scars to see what's going on. And as part of the PhD, I'll be looking under scars, treating, ultrasounding to see difference in terms of circulation, lymph flow, and obviously tissue changes underneath the surface of the scar as well. But yeah, so we're open to a vast majority of people, because it will be like your stretch clinic. People will come for something like that and go, I actually can't stretch beyond that because I've got this scar here that's pulling me down, and things like that are really important. Pelvic floor tearing, trauma, scarring deep within those fascial connections are going to limit your certain movements in your pelvic floor. So I'm just deeply passionate about talking about scars, Rebecca.
Wonderful. Well, you have webinars coming up. You sent
Yes.
me several free webinars for professionals who are interested in this work, scar therapy, part 1, 2, and 3. So, in terms of just getting that information out there, I want to really just applaud the fact that this information is available to get people more interested in thinking about how they can apply it to their business. Is there any recommendation on just like what to attend, say if they can't do all three? I know in each webinar it seems like you offer different things. Will you touch a little bit about your webinar training?
So before I come to Johns Hopkins in February 2027, I'm delivering 3 free webinars. Never again, Rebecca, will I use 3 free webinars. It will always be 4 or 5 or 1, because I can't say 3 and free with a slight lisp that I have. So that's another business thing that I've learned recently. 3 free webinars, and the first one is in July. They're all on my website. You don't have to attend the face-to-face course. You can just do the webinars. It's been staggering, the response. So we have people all over the world that have signed up: Switzerland, Scotland, Saudi Arabia. It's just blown my mind. So I would say, if you can do the first one, and I use lots of my clients' images, obviously with their permission, talking about, does this scar, does it make a difference to somebody? Like, what's the big deal? What's it going to do? Let's have a look at it. Actually, let's then have a look underneath the skin, and we've got some videos of cadavers, and we look at the scarring and how that impacts. So if you can join the first one is really juicy and meaty, all about scars and really what scars are and how they impact the body and the fascia. And then we look at the second one is documentation. Like, let's have a look at how we assess a scar. Let's have a look at outcome measures that we use. Let's have a look at how we document these in notes and the importance of good note writing. And then we have a look at assessment, like how you look, how we assess a scar, but how we assess a person. Because the person in front of you is just more than what they've come in with, aren't they? That emotional aspect, the physical aspect. Not that I want people to work outside their scope of practice, and not that these webinars make you a scar therapist or any title, but to give you an understanding that when somebody presents with a frozen shoulder and they've got a scar on it from surgery, is that scar limiting their range of movement? Or is it the capsule? Is it the joint? Is it the muscle? Is it the nerve? But let's start paying attention a bit more to the scar. So I literally, over the 3 webinars, take you through what is a scar, wound healing, fascia, how scars impact the body, how you document, do an assessment, how you use an outcome measure, how you document, and then how you develop a rehab plan. There's somebody with a scar. So it's basically my 2-day course in 3 bite-sized chunks. So you get to hear lots of little bits.
That is amazing. I mean, that's a wealth of information. Hannah, I can't wait to promote your work. I'm a huge proponent. Thank you so much, really, for just being willing to come on with me and share. Pelvic Health Network, it was my dream to really find people like you. And I mean that sincerely. I mean, to know that physiotherapists are just expanding access to earlier care. Some of my worst, almost like my why cases, but really the worst cases that I've seen were around infected wounds, starting with mastectomy. And then, of course, known for early work in after C-section surgery and seeing those patients actually come back to the hospital where I work from cesarean wound infections, needing a wound vac while they had to still care for their baby and going home with this machine that was attached to their wound. And that just made me think, there's so much that we can do for pre and post surgical recovery. And so you coming across, the channel, Instagram, and just reaching out, and then me taking a little bit closer of a look, and I'm like, oh my goodness, I can't believe I haven't sat down, to speak with you. So the fact that you're coming to Johns Hopkins and absolute wonderful institution. The work that they've done in early mobility I've been really singing their praises since 2018 when I presented on their programming, and so they're really lucky to have you. And I want to make sure we could do everything in our power to tell everyone about it. At least on our platform. So we'll be sending out newsletters. We'll be putting this on YouTube. We're putting this across social media, different clips of it. So I really just want to thank you so much for just sharing what you do, because I'm tremendously excited. This is exactly the type of work we want to highlight here in our network.
That is, Rebecca, thank you so much. I really appreciate it. Thank you. It's a great honor to talk to you. And if you want me to record anything specifically for your network, I spoke with our MASIC Foundation about trauma and tearing in the perineum, in the pelvic floor. I can design something just for you, so you've got something on your network. I'm quite happy to do that as
Our
well.
time difference is pretty significant. I want to make sure. What time is it over there now, please?
It's 9:15 at night. So
We
not
may
too
have to
bad.
do the recording. I was going to say,
Yes.
what are the chances that my audience can talk to you? Because I'm sure they would have questions. And the reason being is that our particular network of therapists, you'll find this interesting. They are not, a large majority of them are not women's health, pelvic health trained.
Gosh, oh, I
Pelvic
thought that was...
Health Network was actually created based off a need that we needed to network with other practitioners outside of pelvic health. And so it was based on the belief that if we could start services early in the hospital, say, specific to childbirth or even pelvic surgery. But the most common major surgery performed in the world was C-section. So we started there. We figured, well, if we could train the acute care therapist to just take vital signs pre and post activity, just prepare moms for going home, maybe we can catch these, leading factors of preeclampsia, the cesarean wound infections. What is mom being positioned like at home? Is she sleeping in a recliner? Is she folding across her incision? Is there moisture? All of this stuff. So we actually went the network route and said, well, what is a network? Well, it's this hub of people that also are connected to all of these really, anchor points that makes care accessible and global. And so we really wanted to develop a network with not necessarily pelvic health professionals, but someone who could be a touch point for us so that we weren't on the receiving end of some of these awful stories and these mental health issues from neglect. And so, like I said, like I asked you, do your courses also include other individuals? And again, you are the type of provider that we're working to bring light of your work. We invest much more into making sure that people are aware of the work that you're doing, because we believe it really helps people long down the road. I mean, you can really appreciate this even with YouTube. Some of our videos a few years ago are now gaining traction, and it's just phenomenal how that works. It's almost like an echo, right? It just keeps traveling. So I'm excited for what you're doing. I think the recording is appealing because those acute care therapists are not pelvic health trained, but now they're interfacing with women who have had either perennial trauma, 3rd and 4th degree tears, or even deeper trauma like levator ani injuries. And so even if there was a packet of information, or if they took your course, they could be doing prehab, so to speak, especially if they touch point with those high risk pregnancy individuals who are admitted to the hospital during pregnancy. Well, that's a packet of information, especially if that person is planning for a cesarean delivery because of the health of their child, who won't make it through a vaginal delivery. I'm already thinking of this so much that you can do. And who can benefit from your training. So, I mean, so be careful when you ask if you can do anything for us. Because, I mean, the answer is, can you start yesterday?
Monday, Tuesday, Thursday, Friday. So if you could do Sunday.
No, so let us at least allow me to just do this for you, to just get people into your work. And then obviously, correct my caption if I go a little bit off the rails. Hannah could do this, and she can help you with this. And, because I'll probably get carried away. So.
I'm honestly, and I genuinely mean this, I am happy to either record like an hour bespoke course for you that you just hold on your platform, that I can talk about scars, and I can talk about some prehab and what you can do for women's health, but for general scars as well. I'm really happy. And if you want me to record a separate one about exactly what advice to give prehab, I'm also more than happy to do that.
That is amazing. Yeah. So we'll maybe touch base, because
Yeah.
if it could be specific to pregnancy,
Yeah,
what you
absolutely.
would actually prepare, someone for either a vaginal, we know with vaginal delivery, what, 80 to 90% may sustain a first degree tear at least, a little less with the higher degree. But someone has to be prepared for a scar either way. I mean, it's very, of course, wanted, the hope would be that you have no injury to the tissue, but the expectation is that tissue will stretch and there may be an injury there.
Yeah.
So that particular population, we tend to get a lot of requests. So perhaps we
Yeah.
start there. We'll discuss more, but at least
Absolutely.
as is, I think that just this first interview is just a great start to the introduction of your work to our audience. So really, thank you so much.
You're welcome. Thank you. It's been my pleasure. So thank you.